Hello friends, welcome back to my channel on pregnancy care. I'm Dini here and hope you are all doing well. So today I'll be talking about diet in pregnancy. What should a pregnant lady eat and not to eat? So let's see one by one. Pregnancy is a time that everyone says that you have to eat for two people. A mother should take double of the diet that they are taking in the normal case. So that is not the actual advice that has to be taken, because normally women needs energy of 1800 to 2000 kilocalorie per day. But when a lady is pregnant, then they may need extra calorie of around 350 kilocalorie per day. So around 2350 kilocalories may be required for a normal sedentary worker. And during the whole pregnancy, a lady should gain weight of at least 7 to 11 kg only. There is no need to gain weight of around 15 to 20 kgs. Average weight gain is around 7 to 11 kg. So uh, a lady can eat normally with an highly nutritious food. That is the recommended pregnancy diet. They don't have to eat the double amount of food they are taking in the normal case. So let's see what are the foods that are recommended for first trimester, second and third. First trimester means the first 3 months. Uh, Once a lady is planning for pregnancy or in the pre-conception stage itself, the women should take folic acid supplement. So it is to avoid any neural tube defects, because folic acid, it helps in DNA synthesis and cell replication. So once a woman or a girl is planning for pregnancy, then they have to take folic acid. So it is seen more commonly in leafy vegetables, dates, etc. So they can take folic acid supplement, and the normal folic acid supplement that is recommended is 500 micrograms per day. And they may have to take uh, other foods also that is rich in protein. And in the first trimester, most of the women, they will be having nausea and vomiting. Because of that, they will not be able to eat anything. So in that case, usually the doctor prescribes uh, frequent meals, that is nutritious, as well as whenever they gets up in the early morning itself, they can take carbohydrate, some kind of carbohydrate, like a piece of bread or rusk they can have, so that they can avoid nausea. So after taking some kind of carbohydrate food, they can go for brushing their teeth and all, because once they vomit or they start having nausea, the whole day will be messy for them. So it's better to avoid that by having a piece of bread or rusk in morning, or a little bit of oats they can have. And later they can have the normal breakfast, as well as in the first trimester and in the whole pregnancy. It's recommended to have seasonal fruits, whatever is available according to the season they can have, and enough water has to be taken for hydration. Around 10 to 15 glasses of water is recommended for a lady during the pregnancy. And they have to avoid caffeine. Maybe they can have 1 to 2 glasses of tea per day, and not more than that. That is not recommended. Okay. And Uh, they have to also include protein rich diet and the foods that are rich in iron and vitamin B6. So they can have asparagus, legumes, then broccoli, cabbage, and for protein they can have egg whites. They can have around 2 to 3 egg whites. If they are having the egg yolk, you can eat one egg yolk per day. So there is no need of taking more than 3 egg yolks, because more fat intake can lead to increased weight gain. So that can be avoided. So regarding the protein recommendation, the recommended protein intake is, for a normal lady it is 55 gram per day, and during pregnancy an extra amount of 15 gram per day is recommended. So total recommended intake is around 70 grams per day. And fats, regarding the fats, it's only 30 grams recommended per day. So they don't have to take extra fats during pregnancy, because it will lead to extra weight gain. And moving further, so in the second trimester what happens is, the baby will be in a growing stage, and bones and uh, bones will be growing, so they may need extra calcium and vitamin D. So the mother has to take extra milk during that time, as well as calcium supplements. So in a normal lady, the recommended calcium intake is around 600 milligram per day, but while in pregnancy, it is almost doubled to 1200 milligrams per day. That is the recommended daily intake. So the mother can have around 2 to 3 glasses of milk per day, and they can have uh, eggs, 2 to 3 eggs. The egg whites can be taken, and egg yolk, one egg yolk can be taken. And they can include legumes, different kinds of beans, and extra protein may be needed. So in that case they can have green leafy vegetables and um, meat. Lean meats can be added to their diet, as well as milk, cheese, all these can be added. They can have curd. So whatever they like, according, if they are vegetarian, they have to include other things like soya milk, and if they are non-vegetarian they can take the meats that have extra proteins, and fishes also. While taking fishes, it is better to avoid big fishes. They can have small fishes, because that has omega 3 fatty acids also. That is very good in the brain development. And also it's recommended that they take vitamin A rich foods like green leafy vegetables. Always encourage the mothers to take green leafy vegetables and nuts to have a good skin. Dry fruits are recommended for mothers. They can have one palm full of dry fruits or nuts. Next, in the third trimester, what a mother should take? They should have vitamin C rich foods, thiamine, water, fiber rich diet, and uh, as said earlier, protein rich food, and they have to take extra calcium and iron. So they may have to take water intake recommended is around 2 to 3 liters per day, and they have to take fiber rich foods, because in the last trimester they will be having constipation. So once they start having constipation, it can leads to It can lead to hemorrhoids and fistula. So in order to avoid that, they can have green leafy vegetables um, in their diet. It will help to avoid constipation, and they should drink a lot of water, around 2 to 3 liters per day. And also they can divide the whole diet into different small portions, because the stomach has already been distended, and the uterus may be pushing the stomach, so they may not be able to eat all the foods at one go. So it has to be divided into small and frequent meals. They can have dinner little early, and whenever they'll get up, they should have early breakfast also. It should not be too late to have a breakfast. They should not skip their breakfast, because long fasting is not recommended for pregnant ladies. And these are the things that has to be kept in mind for a pregnant lady. So what are the things that we can include? They can include breads, cereals, rice and pasta, 6 to 11 portions. And they can have fruits, 3 to 4 portions per day, and vegetables, and protein, 3 to 4 portions per day, and dairy products is very important, and fats, sugars and oils, that is in the less recommended list. It has to be taken with caution. And those who are having diabetes in pregnancy, they have to be very careful while planning their diet. They should take less carbohydrates and replace it with salads and green veggies. And those who are having hypertension, that is increased blood pressure in pregnancy, they should take foods that has less salt. So this is about the diet during pregnancy. Hope you have got some idea. So always a mixed diet is recommended for a pregnant lady. And if the lady is having diabetes, they should go check the sugars regularly, and if insulin is recommended by the doctor, they should take that. And if some medications is being recommended for any other conditions, it has to be taken with caution. So avoid the processed foods or packed foods, and take fiber rich foods, and also include uh, supplements like nuts. Almond is very good for them, so they can have at night they can soak in water, and in the morning they can um, grind it and use it with milk. And they can include oats and all those. So milk intake is very important, protein intake is important. So this has to be kept in mind while planning a diet for a pregnant lady. Fruits and vegetables is important to include, and avoid caffeine, and take all the nutritional supplements that is given by your doctor. So hope you have enjoyed this video, and you have got some information how to plan your diet. Thank you so much. So if you like my video, kindly subscribe to my channel. Thank you so much. See you again.